Thank you for joining us. This is Mature Living. I'm Mayra Yanez, the director of the Senior Adult Program at the El Paso Community College. And of course, this is a time of the year that is called the open enrollment period, and we promise that we will educate our community. We will bring you information that will help all of us. And so we've invited Roy Ortega, who is with Project Amistad. He is the Community Relations Manager. And thank you, Roy, for taking time this morning to be here.
Absolutely, my pleasure.
I'm sure you're going to help us.
I hope so.
Well, good. One of the things that I want to ask first and foremost, when is this open enrollment period, and what are the most frequently asked questions?
Well, it's that time again of the year. This is the fourth year, actually, that we're starting to be fully engaged in enrolling residents, consumers, under provisions of the Affordable Care Act of 2010, as you recall.
Yes.
It went into effect in 2013, and the enrollment period runs from November 1st to January 31st. And we are tasked with going out in the community and providing information about health insurance, the Affordable Care Act, and the health insurance marketplace, so that residents who don't have insurance can be fully informed about all of the provisions under the law and all of the things that they need to know about obtaining health insurance for them. You know, it's the law. Everyone has to have health insurance.
Yes.
There are provisions within the law that stipulate that if you don't obtain health insurance by a certain period, you would be subjected to a fine. Now, the majority of the people are avoiding those fines, and it's very easy to avoid those fines. And one of the most frequently asked questions is that who is eligible? You know, who has to have? Because if you are below a certain level in income, you don't have to participate in the Affordable Care Act. You are exempt.
Yes.
And I can explain that in a little bit further detail, but the fact is that the majority of the people who are just above that income level would qualify for federal government subsidies, which would help bring their monthly insurance premiums down considerably. And so you need to look at that. You need to look at that carefully if you don't have health insurance. We can help with explaining all of that.
And you are experienced. You have staff that are experienced in going through the marketplace, because there are many, many insurances.
Yes.
And one of the questions that has been raised recently is the premiums going up, but that has nothing to do with the law.
That is correct. There is nothing that is contained within the Affordable Care Act that causes health insurance premiums to go up. What is happening is that insurance companies who agreed to participate in the health insurance exchange are making decisions on their own about the cost of the premiums and those kinds of things based on their own reasoning, their own factors. And so those premiums are being passed on, those higher premiums, of course, are being passed on to the consumers. There's been a lot of concern about that, but we have to point out that under the Affordable Care Act, you can, in fact, still be able to obtain a very affordable health insurance plan with good, affordable premiums. And if you qualify for the subsidies, that's even better, because the subsidies will help bring down the cost, the monthly cost of your health insurance plan. So even though that's a little bit of a concern over the long term, the premiums we're being told are going to be going up sometime next year. For right now, you can shop around in the health insurance marketplace, look for other plans that are more suitable than the ones that are raising the insurance premiums. So we encourage people to look into that, and if they would like for us to assist them,
Yes.
to go through the process with them, we can do that for them, because as you know, Mary, insurance is very complicated.
Yes.
You know, even those of us who are doing this every single day sometimes get a little bit, confused and befuddled about how some of these things go. But yes, if you need help trying to figure out what you need for your insurance situation, let us know. We can help you out, and we can point you in the right direction.
Yes.
We won't pick out an insurance plan for you. That's not our job. We give you the information. You make your decision about your own health care.
It's like buying a car.
Yes.
In selecting your insurance plan or the company you want to go with.
Right.
So that you have all these models, all these offerings, these menus,
Right.
and then whatever fits best, whatever you're the one that
Exactly.
decides.
And there's 4 levels of health insurance plans. Starting with the bronze, you got the silver, silver, the gold, and the platinum. And each plan has different levels of premiums and or deductibles. You know, starting with the bronze, where you have a low premium but high deductible, and then at the other end it's just the opposite. So you have to look at these and make a decision on your own as to what best suits your situation.
If a person decides not to go because they assume that it's not going to go to their favor, or they don't know about the subsidies, or they just you just say Obamacare, or you say the Affordable Care Act, and they get turned off. Well, they're missing out.
Yes, it's very easy to get discouraged.
Yes,
very easy. I mean, we have people come to us and they're so confused, they don't know what to do, and we take the time to sit down. We have 6 very well qualified, federally certified navigators on our staff who are experts at guiding people through the process.
At Project Amistad.
Yes.
Very good. And are there any penalties that are?
Well,
if you don't?
unfortunately, yes. But here again, see if in this 3rd year that we're just concluding, the penalty if you don't have insurance and then you filed your income taxes in April of 2017. If you don't have the insurance, the penalty is going to be $695, or 2.5% of the family income. And so there's still time to get that insurance actually between now and the end of the year.
Yes.
And so we encourage people to go ahead and do that. But the vast majority of the people are not going to pay that penalty because there is a way for them to obtain an insurance plan that's going to be affordable to them and be able to help them avoid that penalty.
Yes. Many times, of course, over the years, people go and get health care or go to the emergency rooms and they're not insured.
Yes.
There's lots of loss, there's lots of expense.
Right.
And now at least you're paying a little bit into that pocket.
And something significant that we point out is the fact that before the Affordable Care Act was implemented, there were 178,000 people in El Paso County that were not insured. That's a lot. And if you think about the implications that has on the healthcare system, particularly Thomason Hospital, now UMC, the cost, that somebody has to pay for those healthcare costs, and that usually falls the burden on the taxpayer. Now we have exactly. We have managed to enroll over 60,000 people in El Paso County. That reduces the number of uninsured people in the county, and the impact on the taxpayer is much less.
Yes.
So from that standpoint, that's a very positive thing.
So everybody pays their share.
Yes.
We have just enough time to wrap it up and give information on Project Amistad, the phone number that they can call.
That is correct. And I
Make
need to
an
also
appointment,
point.
right?
I need to also point out that we are part of the Enroll El Paso Coalition. We are one agency among a number of other agencies in El Paso County that are joining together to provide these enrollment services and education to the public. And we are getting together and creating all kinds of opportunities for people to come in and learn about the Affordable Care Act and help them understand it and help them go through the process. That's the Enroll El Paso Coalition. Quite a number of local agencies, including a couple of hospitals and healthcare agencies. And so, but at Project Amistad, they can call us at 298-6997.
Great.
And someone there will take the time to sit down with them, make an appointment for them to come in and go through the entire process. And it doesn't cost them a cent, not 1 cent.
That's great. We've been talking with Roy Ortega, who is with Project Amistad. He's the Community Relations Manager. You be sure and call. Thank you for being here.
Absolutely, my pleasure.
Well, thank you for joining us. This is a very important conversation that we're going to have here on Mature Living about environmental issues. Mayra Cordero is a champion environmental specialist with the community college, and she started working with us several years ago in educating us. And so we've invited Mayra back because she always brings us something different. There used to be the 3 R's of recycling, but now it's 6. So she's going to tell us all about it. Thank you for being
Now
with
we're
us.
adding a few more. Thank you for inviting me, Mayra. First of all, I wanted to see if you could read this for us and share with all of us.
Oh, really?
Yes.
This is the paradox of our time.
Yes.
We buy more, but enjoy less. More conveniences, but less time. We have more degrees, but less sense. More medicine, but less wellness. We spend too recklessly, laugh too little, drive too fast, get angry too quickly, read too seldom, and watch TV too much. And we pray too seldom. So true. We have multiplied our possessions, but reduced our values. We've learned how to make a living, but not a life. We've added years to our life, not life to our years. We build more computers and cell phones to hold more information, but have less communication. That is so true. These are the times of more kinds of foods, but less nutrition. Of fancier houses, but broken homes.
Wow.
Wow, Mayra. You have brought this so beautiful. Thank you
Right.
for bringing us things like this. And this is a rethinking, changing.
Right. This is something that I wanted for you to read. Obviously, I didn't write. I didn't wrote it but I think that it's an opportunity for us to stop and rethink, which is our first R. I mean, we all have the American dream, right? That we want more and more and more and more. But what are we paying for that more? Sometimes we think that less is lack of, right? And it's not, because it's a whole circle that we have. Like, the more we have, the happier we are. And we see that that's not necessarily true, right? A few years back when I got here to the United States, I was so happy because, everything, it's $1, right? Or things like that.
Yeah.
And I can see more and more that we spend more, we buy more things.
And we clutter more.
And we
our
clutter
houses.
more our houses. We have more things to pay, so we spend more time working to pay more things. We feel bad that we don't spend the time with our families, and we buy them more stuff because we feel bad about it, right?
Guilty.
And then we have to work more to pay for that.
Yeah.
And since we have to work more, then we feel bad about ourselves of working so much. Or sometimes we want to give a gift to us, so we go and buy more.
So it's a vicious cycle.
Isn't it? So how can we break that circle, right? That cycle. So I think that the first R is rethink.
Yes.
What do you want out of your life? Do you want to create more memories or experiences with your loved ones, or do you want to buy more stuff? So a clear example how I in my personal life apply that is my nephew, which is my godson too. He became 2 years old, and he got all these gifts, right, for his birthday. And he played with them for a little while, but then he moved on. In my case, what I gave him, it was from a newspaper. I just wrote down that it was worth for me to take him to the zoo in El Paso, because he doesn't live here. Well, they live in Chihuahua.
So he can come and visit and go to the zoo.
So they were coming and visiting, and I took them to the zoo. And once we were at the zoo, I mean, he was amazed by everything at the zoo, right? It's a wonderful zoo, the one that we have here. And his mouth was open the whole time, looking at all the animals. And it got to a moment that I said, well, what's the giraffe doing? Because he was amazed with the giraffe. And I said, the giraffe is eating. And then I said in Spanish, está comiendo. And he looks at me and said, está comiendo. But he said this whole words. And
At 2 years old.
2 years old.
A beautiful
Beautiful
phrase,
sentence, right?
yeah.
Almost. And I mean, he only says mom and dad because he has magic fingers that he can point whatever he wants, right? But it was a magic moment for me.
So it was a gift of time,
Right.
of personal time with the child,
And
as
I
opposed to toys and things.
Right, and I think, I mean, the holidays are coming. And there are all the stores are ready with Christmas stuff. Halloween hasn't passed yet, and they already have all these things, right? So stop and rethink. Do we want more stuff, or do we want to create those memories, those experiences with our loved
I need
ones?
to make those changes, that change of attitude,
Right.
that so important.
And then another way to apply the rethink is the declutter.
Oh,
Because do we own our possessions, or do the possessions own us? I mean, I read that question and I was just like, wow, isn't it true? All the time that we spend Well, first of all, buying, right? And then second of all, paying for it. And then organizing, cleaning, putting it in the places that they belong.
And then they end up in the dump.
So basically, we're just throwing away our money, right? That's what we're doing. And I had the opportunity to talk to a lovely lady right before I came in with you. And she was saying that, for example, for Christmas, she just like makes some cookies and then give them to, because her children are already grown up. When you buy something, like you buy clothes to them, and they don't like it. They don't wear it, or they don't like that style, or they don't like that color, right?
I learned my lesson on that one.
So, I mean, and we tend to notice that we don't appreciate it, but sometimes we have so much that we lose the value of things, right? So, seeing instead of buying more, how can we create that? The second R will be refuse, and it's all of the R's are so connected with each other. I mean, refuse, for example, plastics that we have talked in the past, right?
Yes.
Because plastic affect, we get to have a plastic life sometimes, isn't it? Wow. And it affects us so much in so many different ways. For example, the way that we extract the oil, it affects our environment, right? The way that the way that we consume those products with plastic that have those chemicals in it.
And they never go away. And they last for centuries,
right?
Plastics.
And then the animals are eating the plastics, and then we eat the plastics. Okay. And it's the same thing, again, it's connected. I mean, buying more plastic, where is it going?
Yes. And reduce.
Reduce, right?
I think we're going to get through 3 R's today, yes. And then we'll continue with other R's.
And again, everything is connected to the everything. Reduce. How can you reduce in your life? Because the simple life that you have, my perspective, it's better. You have
better for your health.
Better for your health.
Better for the environment.
So where are those things that you can reduce and say, okay, maybe I don't need 20 products to clean my house. Maybe I can.
That's right. You're just amazing.
Thank you.
You're just amazing as a young person, teaching us seniors how we can make our life better. You want to give your phone number in case people want to call you?
Yes. So my phone number is 831-3325. They can call me anytime, and I'll be more than glad to explain you anything that you want. And
you can go and speak to groups as well.
Right. So part of our community college, we like to reach the community.
Yes. Well, I know there are some ladies in church groups that would love to hear your thoughts and share how you think about the environment, how we can preserve and conserve our community and keep it clean. Well, we want to continue our conversation with Mayra Cordero, who's the environmental specialist at the El Paso Community College, and she's always so interesting. And we just talked about rethink, refuse, and reduce. And she explained that so well that we wanted to continue with the other 3 R's, because originally she came in with 6. and the next one, the next 3 we're going to talk about is reuse, recycle, and react. Oh, Mayra, thank you for staying with us to continue our conversation. Tell me about those 6 R's, how you came up with it, and what we're going to talk about in the second part.
Okay, I think it's a combination that in all my research started looking at it. How can we make a difference, right? How can we have an impact, a positive impact?
Yes.
Continuing with our R's, reuse, it's basically, for example, how can you apply it? We go and buy so many clothes, and we're so happy of buying that it's $4.99. It's on sale. We need it, right? We need it
just because it's on sale.
Because it's on sale. But if you have the opportunity, there is a documentary very good that is called "The True Cost." The true cost of clothes, right? So the lady who makes overseas a shirt gets paid $3 a day. And the impact on her life and the impact on the chemicals using to make that shirt, it's tremendously. And those chemicals, well, they come with the clothes, right? They don't stay overseas.
Yes.
Even if we wash them, I mean, it comes there. So applying that reuse part. We only use 20% of our closets.
And the clothes aren't torn or thin from wear and tear
No.
like they used to
Right?
in the olden days.
So
I know my
reusing-
dad had a shirt that, man, it was like you could see through it because he would wear it. So
Reuse it and reuse it all over again. Or maybe we can start buying, there's many stores here in El Paso where you can buy used clothes in very good conditions, because people, like you said, they don't use it until the end. Sometimes they even leave the tags on it, because
the tags, yes, you find those in the thrift stores.
a lot of them.
At Goodwill, at Savers, all these wonderful.
So maybe you can be
Salvation
saving
Army
a lot of money in reusing,
Okay.
right?
Very good.
And then recycle. Recycle, I mean, I have a job out of recycling, right? So it's very, very good, but we have to keep in mind that first we have to apply the other R's, like the refuse plastics, the
Yes.
reduce the amount of stuff that we buy.
Yes.
Now, once we get the trash that we have, where are we gonna place in the recycling bins? Paper, aluminum cans, and the plastic bottles, right? A cardboard can be placed as well, but the cardboard makes sure to flat the boxes.
Flatten them up.
Now, you cannot put styrofoam.
No stuff.
No styrofoam. No,
No glass.
glass, right? No glass. I know that you're gonna have a person who's gonna come and talk to you more about from the city about recycling.
I hope, yes, because
Yes.
I think there's people putting empty pizza
Boxes,
boxes,
right?
and they don't want those either.
They don't want, because it contaminates the recyclables and it lowers the quality. So all the job from all the other people put in the recyclables, it just goes to the trash, right?
Yeah.
And finally, the react.
Yeah.
Why? Because it's great that we talk and talk and talk, but if we don't do anything,
If we don't act,
if we don't act and we don't react, this is our time for us. I mean, I know that sometimes it gets hard for people to listen to us,
yeah, I'm one of them.
right? But react and do something. Get active in your community.
Make a commitment.
Make a commitment.
Just one thing.
Right.
How about starting with clothes, the ones
Right.
you don't wear or you haven't worn for 2
So-
years or whatever?
Let it go and give to somebody who
To
can use it,
reuse.
right?
Yeah,
To
okay.
reuse. So
And I love that story you gave me about the time that we need to spend, quality time. Instead of giving gifts, things to children, that we think about giving them a gift of a visit to the zoo, like you did
Right.
with your godson and your
Right.
nephew.
yes, I mean, let's stop and rethink, apply those R's, and at the end of the day, react and do something good for the community, for you, for the environment, right? Don't be buying more stuff. Create those memories and experiences with your loved ones.
Yes, that's very nice. Mayra, I know you have a phone number, and you can go out in the community and give
Right.
presentations as well.
We can.
And I think we have to sensitize ourselves and change our attitudes. Tell me about that, and the research that you've seen. What about our attitudes about recycling and
And
buying and more and more and more?
You know, it's very important that we start looking at our American dream. Maybe our American dream needs to be changed. And with that, our attitude. Because more is not necessarily better. Exactly. You said it so correct. So changing that perspective, right? Changing that attitude. If you smile to the world smiles back at you. That's for a fact.
Oh, that's
Right?
beautiful. And we start with the children, and many times our seniors are the grandparents that are picking up the kids after school. Well, how about a little conversation about recycling and about conserving and preserving our environment, and starting at a
Since
young
they
age?
live. And they listen, even though sometimes they're so busy with the technology, right?
Yes.
But taking the time, grandparents are to spoil the kids, but also to teach them great lessons. I know that I got one of the biggest lessons from my grandparents.
Yes.
So take away those cell phones for a little bit, they'll survive.
Yes, that's
And-
right.
And take them to the park and take them to outdoors,
Yes.
react.
Is there some other message that you feel is really important that we haven't mentioned I notice you bring your recycling, everything. That
My
you can take-
recycling bag and my recycling container. Those are little steps that we
Don't
can
buy
do.
plastic.
Don't buy plastic.
Don't take those plastic bags.
Right, take your own tote bag. I mean, we used to do. I know that we used to do it all the time before. And take your own container. There's no need for you to be spending money on tap water in a plastic container when
Yes.
you can just get tap
I
water.
wondered
from
why seniors in the old days, you know, when I was little, would take their empty bags, and I didn't know why. But it was to buy groceries because they would buy the groceries for the day. They didn't have freezers that would you'd put food in there and last for months. That's not good. Just buy enough for the week or for the day, for 2 or 3 days, and
take your
whatever
own
fits in
track.
the bag, that's for the
Right.
day.
And it's because we throw away so much food too.
Yes,
right?
we do. Yes, we do.
And that right there, we're throwing away money and we're throwing away everything. So.
Well, you always kind of open our eyes and instill us to continue to rethink, refuse, reduce,
Reuse, recycle, and react. Go and take action. Go and vote, right?
That's it. That's one of the things we have to do. Thank you
Yes.
so much.
Thank you.
I really appreciate you,
Thank
Mayra.
you so much.
Paulina Polly Ramirez, a student in the Senior Adult Program Expressions of Life class. Ms. Ramirez joined this class to learn to write. Her dream is to write a story about our ancestors so our children can know our beginnings.
Bonding with Grandma. I was raised by a wonderful grandmother who was the only person who could handle such a special baby. I was a very fretful child who was prone to temper tantrums, needing special milk, and was generally a handful. My grandmother was the only person who could handle such a difficult child. So it was that my grandmother and I formed a very special bond. I was blessed with a beautiful, precious, healthy gift from heaven, my granddaughter. Then an idea came to me that I would like to bond with her as I had with my own grandmother. I was allowed to have her on Tuesday and Thursday. That was the start of the most wonderful time. What joy and happiness I felt every morning when baby arrived. I enjoyed her infancy, so new, so pure, so full of innocence, learning daily so much. Soon we started on solid foods and she promptly took her little spoon and taught herself to feed herself perfectly. No need for a bib. I was totally devoted to my baby. Very soon she was about 2, looking for another type of toy. Thus paper dolls were found. With much patience we cut each little doll, dresses, pants, etc., where she learned how to perfectly match each outfit as to color and theme. Soon she turned 3 and was enrolled at a Tuesday and Thursday school, so my daily joy and happiness with her ended. I felt that was too short a time for us to bond, so I prayed. Recently she came to visit. We talked about downsizing. She immediately asked if she could have something. Whoops, I thought. Hope it's not something I have already discarded. I held my breath as she said, my paper dolls. She jumped up, went to the drawer where they had always been saved, came back smiling and said, they are there. We did bond in a wonderful new way.